Dengue virus infections, once a health threat confined to tropical and subtropical regions, are now becoming an increasing concern in the United States. Over the past few years, cases of dengue fever have spiked in regions previously untouched by the virus. As the threat grows, understanding how dengue is transmitted, recognizing its symptoms, and knowing the risks are crucial to preventing the spread and protecting public health. The dengue virus. An overview: dengue is a mosquito-borne viral infection caused by 4 closely related viruses: Dengue 1, Dengue 2, Dengue 3, and Dengue 4. The virus is primarily transmitted to humans through the bites of infected Aedes mosquitoes, particularly Aedes aegypti and Aedes albopictus. These mosquitoes thrive in tropical and subtropical climates, making regions in Latin America, Southeast Asia, and the Caribbean particularly susceptible to outbreaks. However, in recent years, the range of Aedes mosquitoes has expanded, partly due to rising global temperatures, increased urbanization, and global travel. This expansion has brought them to areas of the United States where they were previously uncommon, raising concerns about the potential for dengue outbreaks within the country. Climate change and the spread of dengue. One of the main factors behind the increased risk of dengue virus infections in the U.S. is climate change. Warmer temperatures create a more hospitable environment for Aedes mosquitoes to thrive and reproduce. Aedes mosquitoes are especially sensitive to changes in temperature, and warmer weather allows them to breed more quickly and bite more frequently. In addition to warmer temperatures, changes in rainfall patterns have also contributed to the spread of mosquitoes. The Aedes mosquito prefers to lay its eggs in stagnant water, and heavy rainfall followed by periods of warmth creates ideal breeding conditions. As climate change leads to more erratic weather patterns, regions that were once unsuitable for mosquito breeding are now seeing growing mosquito populations. These environmental changes have made regions in the southern United States, including Florida, Texas, and parts of California, particularly vulnerable to the spread of dengue. As temperatures rise, the geographical range of the Aedes mosquitoes is projected to expand further, potentially exposing more regions of the U.S. to the risk of dengue transmission. Local transmission in the United States. While most cases of dengue in the United States have historically been associated with travelers returning from endemic regions, local transmission has become a growing concern. Local transmission occurs when a person who has not traveled to a dengue endemic area contracts the virus through the bite of an infected mosquito within the U.S. itself. In recent years, there have been reports of locally transmitted dengue cases in states like Florida and Texas. In 2020, for instance, Florida reported more than 70 cases of locally transmitted dengue, a sharp increase from previous years. While these numbers may seem small, they highlight the growing potential for localized outbreaks, especially in areas where Aedes mosquitoes are prevalent. What makes dengue particularly concerning is that once a mosquito becomes infected with the virus, it can continue to spread the disease to humans throughout its life. This means that even a small number of infected mosquitoes can lead to a significant number of dengue cases if the conditions are right. Health risks and symptoms of dengue fever. Dengue infection can range from mild to severe. The most common form, known as dengue fever, causes symptoms such as high fever, severe headache, joint and muscle pain, often referred to as breakbone fever, rash, and nausea. These symptoms typically last for about a week, but recovery can be slow, leaving individuals feeling weak and fatigued for weeks or even months. However, a more severe form of the disease, known as dengue hemorrhagic fever, DHF, or severe dengue, can occur in some cases. DHF can lead to bleeding, blood plasma leakage, and organ damage. If left untreated, severe dengue can be fatal, especially in young children, the elderly, and those with weakened immune systems. A major challenge in controlling dengue is that there are 4 different types of the virus. Infection with one type may offer immunity to that type, but it increases the risk of severe illness if the individual is later infected with a different type. This phenomenon, known as antibody-dependent enhancement, ADE, is why repeat infections with dengue can be more dangerous, preventing the spread of dengue. As dengue infections rise in the United States, prevention is key to controlling the virus. Since there is currently no specific treatment or widely available vaccine for dengue, reducing exposure to mosquitoes is the most effective way to prevent infection. Some key prevention strategies include eliminating standing water. Aedes mosquitoes breed in stagnant water, so it's crucial to remove or cover items that can collect rainwater, such as buckets, tires, or flower pots. Using mosquito repellent, applying insect repellent, especially during peak mosquito activity hours, dawn and dusk, can help reduce the risk of mosquito bites. Installing screens on doors and windows. Ensuring that mosquitoes cannot enter your home by using screens or keeping windows and doors closed can provide additional protection. Wearing protective clothing, long-sleeved shirts, long pants, and socks can help minimize exposed skin, making it harder for mosquitoes to bite. Public health agencies in the U.S. are also stepping up efforts to monitor and control mosquito populations in high-risk areas. Mosquito control programs, which involve spraying insecticides, removing mosquito breeding sites, and monitoring mosquito populations, play a crucial role in reducing the risk of dengue transmission. Thank you for watching this important video on the growing risk of dengue virus infections in the United States. Stay informed, take the necessary precautions, and help spread awareness. If you found this video helpful, please give it a thumbs up, subscribe to the channel for more health updates, and hit the notification bell so you don't miss future videos. Stay safe, and let's keep fighting against preventable diseases together.